All right. Hello, hello, hello. Welcome. I see many are coming in. Good job. And we are anticipating that there will be even more. Welcome to the first virtual health fair of the 14 health fairs that will be hosted between September and October. And so I'm Catrell Walker, for those who have not yet met me, but have only read my numerous emails that I've sent to you. And today we are excited to provide you with an opportunity to talk to the experts. However, before we begin, we do have some housekeeping rules, and I want to explain the way we will progress today. First and foremost, we have the CalPERS health plans that we'll present. And a part of the health plan that is new this year, the CalPERS health plans that is new, is our new pharmacy benefit manager, which is going to be in 2026, CVS Health. So just be aware that the representative will be talking to you. Each of the presentations will be 10 minutes each. You don't have to worry. I've requested no recording, so you'll get a live person. All right. Before we begin, the last thing I would like to do as a housekeeping, please hold your questions until we get to our 10-minute question and answers after all presentations have been made. There will be no questions answered during the presentation. However, if you'd like to put questions in the chat, please do so. And there are individuals here on the line with me who are assisting to, gather those up and make sure that the rep that can answer it will be able to answer. Um, on the call today is the health benefits unit from the district office. They will not be presenting, but they will have a breakout room. When the breakout rooms open, please be aware that we'll try to get you in those rooms quickly. But you will also have the capability to actually move yourself into the room of your choice or move yourself between all of the rooms that will be open by the end of this meeting. We have a total of 12 carriers and benefit plan representatives that will be on the line today, but we're going to start now with our presentations. Please remember this is a public forum. Do not share your private health or that of anyone else or your private financial information in this public forum. If you need any kind of assistance, we will try to indeed get you that information right away. So with that, I'm going to uh, first ask Anthem to please share your screen, introduce yourself, and kick us off with today's virtual health fair.
Hi, I'm Ashley from Anthem. I will be taking us through the Vivity HMO plan, the traditional HMO plan, and talking through some health and wellness opportunities as well. Hopefully, I'll be able to get through that in 10 minutes, but we also have the breakout rooms as well. So let me go ahead and start sharing my screen. All right. So today I am excited to introduce you to the 2026 Health and Wellness Program offerings. These are designed to support your whole health and wellness journey. Our offerings are built to provide you the support you need wherever you are in your health journey. First, our condition care program is ideal for those. Oops, I'm so sorry, guys. Sorry about that. All right, so Vivity stands out due to its unique collaboration between Anthem Blue Cross and several highly ranked Southern California health systems. This collective approach changes how healthcare is delivered by ensuring consistent and excellent care through shared information and best practices. Some of the notable partners include Cedars-Sinai, UCLA Health, and Memorial Care Health System, among others. The Vivity Network not only provides access to these prominent health systems, but also offers extensive geographical coverage throughout Los Angeles and Orange counties. This ensures that care is accessible wherever you live and work. Throughout this network, you experience a member-first healthcare approach that guarantees quality and cost-effective health services. Choosing a primary care physician, or PCP, makes the first step in managing your health with Vivity. Your PCP acts as your main health coordinator, handling everything from annual exams to preventative care. You will have the flexibility to choose from various medical groups or independent practice associations, IPAs, within the Vivity network, which opens up more options for your healthcare journey. Moreover, Vivity's structure allows for greater flexibility when accessing specialty care. With direct access, you can see certain specialists without a referral from your PCP. The expanded choice feature within the network provides even more access to specialists, enabling care from partnering medical groups when needed. This is subject to approval based on medical necessity. Vivity offers in-person visits and modern telehealth options. The Sydney Health app allows for seamless virtual visits and access to a range of healthcare services, all at the same copay as an office visit. Additionally, programs like My Health Advantage and Condition Care support your ongoing health needs by providing personalized health reminders and management support for chronic conditions. The Vivity plan also provides a smooth transition process for members moving from their current plan to Vivity, ensuring no disruption to your ongoing care or prescriptions. A dedicated special team is available to assist with this transition, and any additional services you might need are available 7 days a week between 7 a.m. and 8 p.m. PST by calling 855-839-4542. As a Vivity member, you benefit from a global reputation for excellence in healthcare and a network dedicated to collaboration. This includes using cutting-edge technology for securing health information and facilitating coordinated care, ensuring you receive the best possible outcomes. We invite you to explore more about what Vivity can offer by visiting anthem.com/ca/CalPERS or contacting our customer service for personalized assistance. You can choose Vivity for a personalized healthcare experience that prioritizes your health, convenience, and peace of mind. So with that, I'm going to switch over to the next presentation on the traditional HMO. All right. So the traditional HMO plan is designed to promote whole health and wellness. This plan offers straightforward access to our extensive network of HMO doctors across 36 counties. This ensures you find the care you need. Here's how it can help you. You will choose a primary health care physician, or PCP, within the plan's network. Your PCP is your main healthcare partner, coordinating your care, providing annual exams, and making necessary referrals. You can choose from a medical group setting where services like lab tests and prescriptions are available in one location, or an independent practice association offering more personalized office environments. Financially, the traditional HMO plan is crafted to fit your budget with low copays and no deductible. Key services such as preventative care, hospital visits, lab tests, and x-rays have no out-of-pocket costs. Office visits, urgent care, and even enhanced acupuncture and chiropractic services generally only require low copays. For acupuncture and chiropractic care, you receive up to 20 visits per year without needing referrals, providing you visit in-network practitioners. Monthly premiums vary by region and coverage type, ensuring flexibility for different needs. For example, rates are available for single, two-party, and family coverage throughout California's different regions. For added convenience, the Sydney Health app allows you to manage your health plan anytime, anywhere. With just a few taps, you can find doctors, check copay amounts, and even book virtual visits with healthcare providers through Live Health Online. Whether you need a quick consultation for common health issues or mental health support, this app connects you to professionals around the clock. We also have programs like 24/7 Nurse Line and Condition Care that offer additional support to guide you through health questions and managing chronic conditions with expert advice. Finally, you can embrace the full support offered through the Building Healthy Families program, providing resources from family planning to the toddler years, ensuring your family's full well-being. For more details, you can always visit anthem.com/ca/CalPERS. And remember, we're here to help you make the most out of your health benefits with the traditional HMO plan. All right, real quickly, I will move on to the last presentation on the health and wellness benefits. I know I'm probably almost running out of time. All right. So our health and wellness programs are designed to support your whole health and wellness journey. Our offerings are built to provide the support you need wherever you are in your health journey. Firstly, our condition care program is ideal for those managing chronic health conditions such as asthma, diabetes, or heart issues. You'll work with nurse care managers who will collaborate with you and your doctors to tailor a plan that helps you manage your symptoms effectively. For more complex cases, complex care is here. If you juggle multiple health conditions, this program connects you with a dedicated care team to help navigate your care plan and avoid unnecessary hospital visits. Expect personalized guidance and support every step of the way. If you've recently been discharged from the hospital, our case management service offers personalized support to transition smoothly from hospital home. From follow-up care to managing medications, our case managers ensure you're on the right path to recovery. For families, the Building Healthy Families program supports you through every stage, from planning to parenting toddlers. With access to maternity nurses and virtual lactation support, you'll find tailored resources to assist your unique journey. For unique access to healthcare, we've talked about Live Health Online for video visits with the healthcare provider. It's available 24/7 and good for concerns such as colds, mental health, and more. And we also have the 24-hour nurse line that's available to help you make informed health decisions day or night. We also have the Sydney Health app, and which is your go-to for accessing all of these services. You can track your health expenses to schedule virtual visits, and it's a seamless way to manage your healthcare on the go. The health record feature allows you to organize and securely store your health history in one convenient location. By entering details such as health conditions, immunizations, tests, and medications, you can easily share this information with your doctors and help avoid potential drug interactions or unnecessary procedures. The Diabetes Prevention Program by LARC provides 24/7 access to digital coach who provides personalized text-based support to help lowering your risk of developing type 2 diabetes. And finally, you can take advantage of our special offers for discounts on health and wellness programs, from gym memberships to vision care, helping you save money while staying healthy. Remember, these programs are here to ensure you have the tools and support needed to achieve your health goals. Thank you for being with us today, and here's to your health and well-being. Please join the Anthem breakout room if you have more questions. And thanks again.
Thank you, Ashley. That was great. Okay, next up, we want to hear from the HealthNet representative today regarding the excellent HMO plan they have as well. HealthNet?
Thank you. Hi, everyone. I'm Shirley Liu, and welcome to HealthNet's 2026 open enrollment for CalPERS members. Let me advance to the next slide. And so whether you're new to HealthNet or coming back for 2026, we're excited to share helpful information about your coverage options, benefits, and wellness resources. So let's explore what HealthNet has to offer this year. I'm going to move on to the next slide here. So why consider HealthNet for your 2026 coverage? So we're committed to making a positive difference in the lives of the people we serve. So for over 45 years, HealthNet has supported Californians through every stage of life with accessible, reliable, and affordable health plans. Our strength lies in offering value-packed HMOs, plans designed with your health and budget in mind. We are a local company that understands the unique needs of Southern California communities. And our Salud HMO EMOS plan reflects that commitment. So let me tell you more about our Salud HMO EMOS plan. This is a tailored, specifically for CalPERS members in Southern California. You'll have access to quality network of doctors, hospitals, and specialists near where you live or work. Plus, the plan includes cross-border physicians access in Mexico, hence the Salud HMO EMOS naming of this plan. So this, let me move you to the next slide here. So this gives you an idea of the service area that's part of the Salud HMO EMOS network. And you'll see that it's mainly in Southern California and yeah, and with access to the SIMSA network, which is right across the border. Let me go ahead and here we go. So this is the summary of benefits for our plan. And as you'll recognize, it's very similar to all the other plans, traditional HMO plans that's being offered. So you have preventive care with zero cost share. Doctor visit is $15. So whether you're using HealthNet's network or the SIMSA network, it's $15 for both your PCP office visits and your specialists. Teledoc, which is a telehealth provider, that would be zero cost share. This is a great service and a great way to access care. And then you have vision exams for refractive eye exam at zero, x-rays, prenatal, postnatal, office visit, hospitalizations are all zero copay. Urgent care is $15 and the emergency care at $50. And lastly, here you'll see chiro and acupuncture. That's $15 per visit with a max visit of 20. So this is just a sneak peek of the benefits overview. So this is our wellness and support program. So at HealthNet, we believe in empowering you with tools and support to build lasting healthy habits. Here are just a few wellness programs available to CalPERS members. So first we have the health coaching program. So this is, making healthy lifestyle changes can be tough, but you don't have to do it alone. So we have coaching programs offered support for programs such as managing stress, improving nutrition, quitting tobacco, and more. And then here you see Craving to Quit. This is our tobacco cessation program. It's designed to help members quit smoking or vaping for good. It includes a 21-day plan with digital and phone coaching support. And then lastly, here you see the Real Age Test. So this is a quick, insightful way to get a snapshot of your overall health, covering physical, emotional, and even financial well-being. So you'll receive a personalized feedback and actionable recommendations. We really do prefer our members to do this Real Age Test before meeting with their provider, before an annual physical, for instance, just to compare and then review the results with your provider for a tailored, care program with your doctor. And then here are more ways to access care. So the first item here is WellV. It's a surgery decision support. So it helps you decide, prepare for, and recover from surgery. And there are some incentives, right? So if you complete the first 3 modules of the program and a brief survey, you'll receive a $25 gift card. The next item here is diabetes prevention. So get the tools and support you need to lose weight and lower the risk for type 2 diabetes and heart disease. Here you'll see nurse advice line. So that's our toll-free line that gives you access to a nurse that's 24/7. And it's great for guidance on health concern. And then lastly here, you'll see Teladoc Health. I know I mentioned this earlier. This is a zero cost share program available to you. So this is where you could speak with a doctor 24/7 or a therapist on weekdays at 7 a.m. to 7 p.m. at no additional cost, as I mentioned earlier. And they also have the ability to write a prescription. And so it is a great tool and a great way to access care when you are unable to see your medical group, your primary care physician. Oops. Here we go. So these are, ways to earn incentives for healthy actions, right? So we reward you for taking steps to improve your health. And so these are some of the ways. So if you were to complete the Real Age test, you can earn up to a $50 gift card. So that's an additional $25 for sharing the results with your PCP. If you are looking to join the Craving to Quit program, there's a $25 gift card for completing the program with a coach. Then the health coaching opportunity. So again, there is a $25 gift card there. And then same with WellV. If you have an elective surgery that you'd like to prepare for and you participate in WellV, you can earn $25 in gift cards there as well. So getting more done or get more done online through healthnet.com/CalPERS. So our custom HealthNet website makes managing your health easy. So you can view benefits, copays, your evidence of coverage, scheduled benefits, and coverage. So the SBC, you have access to that through the website. You can search for doctors and specialists through the tool. And then you can also access, a copy of your ID card, get forms, review medical treatment policies, all in one place. And if you need additional help, we're here to support you. Here is the phone number to our dedicated member services team for personalized assistance. Also visit our CalPERS specific website for resources, tools, and information. And also, if you have any additional questions specifically for HealthNet, please join me in the breakout room. I'm here to help. And yeah, so that's it. So thank you for your time today. We look forward to supporting your health journey in 2026 and beyond with HealthNet.
Thank you, Shirley. That was beautiful. Okay. Next up is none other, and a lot of you may still remember her from last year, Sandy Cisneros from United Healthcare. Sandy?
Hi, thank you, Catralia. Let me go ahead. I'm going to stop sharing my video and let me share my PowerPoint with everyone. So hold on a second. Okay, there we go.
It's coming. There we go.
Good. Okay, good. Hi, everyone. Happy Friday. I'm Sandy with United Healthcare, and I'm going to give you just a brief overview of your 2026 United Healthcare basic HMO plans today. Let me go ahead and do that. Go to our next slide here. So as a member, you'll receive tools and support to help you save time and money and find care when you need it. I'll review some of the benefits and wellness programs that you can expect in our plan as well. As you can see, United Healthcare has two HMO plans. We have our Signature Value Alliance and our Signature Value Harmony plan. Our our Alliance HMO plan is available in 26 counties throughout California, and we also offer our Harmony HMO plan that is available only in 10 counties in California. So with the Alliance HMO plan, it's an original health plan offering with a distinct subset of United Healthcare network providers who collaborate on your care and help you manage your health. For the Harmony HMO plan, it's designed to help you navigate the healthcare system more easily while providing access to doctors who may help guide you to better health and lower costs as well. To confirm which United Healthcare HMO plans are available in your home or zip code area, please use the CalPERS Health Plan Search by Zip tool on the calpers.ca.gov website. The Alliance and Harmony HMO plans require you to select a primary care provider from the plan network to help you manage your health care. So each enrolled person must select a primary care provider. You can easily search for a physician on our website as well at uhc.com/calpers. On here also, I do have the copays and the different benefits that are available. And as you can see, you have your primary care physician, which is only $15, the copay. The specialist is also 15. And in order to see a specialist, you do need to get a referral from your primary care physician. Your emergency services are $50 and urgent care is 15. And the virtual visits are 15 as well. Your lab, x-ray, DME, that is at no charge. And also you do have chiro and acupuncture. And a lot of people, they're not aware that their medical plans do offer chiro and acupuncture. And the copay is only $15 and it's 20 visits combined per year. So new for 2026, CVS Caremark is your United Healthcare Plans Pharmacy Benefits Manager. With CVS Caremark, it will be easy to save on medication. If you choose to receive your prescriptions by mail, you could get up to a 3-month supply for 2 copays, and you'll save a trip to the pharmacy as well. So if you have any questions in regards to that, I know the CVS rep is here. They can assist you, but there's also their information on my screen if you want to look at the website and also or contact them as well. So let's talk about the 24/7 virtual visits. So when you're not feeling well, reaching a provider by phone or video call is not only more convenient, but it also saves you money on care. You can set up a virtual visit right when and where you need it by using the United Healthcare app or visiting the myuhc.com website. So, yeah, virtual visits are great for common conditions like bronchitis, cough, colds, flu, headaches, uh, even if you get pink eye. And you may even be able to get a prescription called in as well. As I mentioned before, there are the available services for chiropractic and acupuncture. On here, you can see the 4 steps on how to find a provider in our brochure that's also going to be there and also on our website as well. You can see at uhc.com/calpers. We also offer, as part of your wellness benefits, the Calm Health app, and that is a free app, which it's a nice tool to use. You can use it on your phone. have access to support and services regarding better sleep, building skills to manage stress, developing resiliency, and starting and building mindfulness habits. I don't know if any of you've heard, I know this is probably kind of aging me maybe a little bit, but Matthew McConaughey's voice also comes on and helps you with meditation and talking to you. So just a little note on that. United Healthcare also offers Real Appeal. So with Real Appeal, this is an online coaching program that assists in building a healthy lifestyle and weight management. And it's also designed to build better habits across key areas such as nutrition, fitness, sleep, and stress as well. So with that, the program includes online coaching which offers encouragement based on your lifestyle and goals, a success kit which includes both weight and food scale, along with healthy recipes and workout equipment. And also you get an online dashboard that helps you set your goals, track your progress, stream workouts, and more. United Healthcare Rewards. Get more out of your health plan with United Healthcare Rewards, where you can earn up to $300 for things you may already be doing, like tracking your steps or sleep. The activities you go for are up to you. If you have a spouse or domestic partner enrolled on the plan, they can also earn up to $300 as well. Once you're a member, start earning by downloading the United Healthcare app and activating your UHC rewards. Digital tools to keep you connected. And I know throughout the presentation, I've been throwing websites to get into the different apps to look at the wellness benefits with United Healthcare. So once you're a United Healthcare member, you will have access to personalized digital tools. And these digital tools give you quick access to resources designed to help you, such as viewing benefit information, searching network providers and facilities for the type of care you may need, accessing your health plan ID card, and um, you can learn more about your covered preventative care as well. So it's a great tool just to have on hand and see what's going on with your United Healthcare wellness initiatives as well. So help is just a call away. So we have our dedicated customer care team, which is available by phone to answer any questions you may have. You do not need to be a United Healthcare member to call our advocates and ask questions about our benefits. You can also visit our website as well, where you'll find all of your benefit information and more. Thank you for letting me explain some of these benefits to you. I hope it was helpful. And just know that I will be out. I will go into the breakout room if you have any questions as well. So thank you once again, and I hope everyone has a great and wonderful day after this. Thank you.
Thank you, Sandy. That was beautiful. Very concise, but exactly the information we needed. And so now I am excited to see that Katie Santos has returned to Kaiser's virtual health fair with me. So we also have Rachel Aguilar as well. And so would you two ladies take the screen and begin your presentation? But welcome back, Katie.
Thank you so much. Rachel will go ahead and present, but I'm very happy to be back.
Thank
And nice to see you, Katrelia.
you.
Good morning, everyone. My name is Rachel Aguilar, and I am an engagement specialist with Kaiser Permanente. And today we're just going to review your 2026 benefits and added benefits available to you as a Kaiser Permanente member. And before I mentioned that I will be available in the break room, and I will go in detail with the information that I will be providing today. So questions, I will be more than happy to answer questions in the break room. So as far as Kaiser Permanente, as you know, we are the HMO option. Permanente unique is that we combine caring coverage. So we're not just your health plan, we're also your medical provider. So as far as the benefit that you have, it's an HMO plan. We're not just your health plan, we're your medical provider. We combine care and coverage. So what that means to you is that your care team is connected, and most importantly, it's connected to you. So once you visit a Kaiser Permanente facility, they'll have your information in real time. With this, we offer seamless in-person and virtual care, 24 access wherever you are, to either emailing your doctor or that telehealth or video visit that's available to you. We also offer support for mental health and wellness. And again, preventative care is key on how we practice medicine at Kaiser Permanente. Moving on to the next slide. We offer care that you are in the center. So with Kaiser Permanente, again, as mentioned, preventative care is key on how we practice medicine. Please know once you're a Kaiser Permanente member, your care team will reach out to you to schedule that in-person visit to get you started to receive all those services based. Again, we have detailed information on preventative care on kp.org/preventative care based on your age and your sex. So basically, you're going to get that annual physical that's available to you. As far as physicians, we are an HMO plan. However, you're always able to switch doctor based on your needs. So once you enroll on the virtual platform, you're going to get assigned to a physician that is close to your zip code. However, please know that you could switch your physician at any time. The change is within 2 days. It could be based on language, near home, near work. My daughter is a Kaiser Permanente baby. She was born at Zion Hospital in San Diego, female, had a male doctor, loved her doctor. However, when she turned 15, she decided, Mommy, it's time for a change. I need a female doctor. She hugged and cried her physician because she loved her physician. However, you're always able to make that change. So please know that that is an option that is available to you. As far as seamless in-person and virtual care, please know that our video visits, Get Care Now options that are available to you over the phone is the same quality care as an in-person visit. As mentioned earlier, your information is available to our care team that is treating you in real time. So they have that information available to you to see what makes you unique, right? As mentioned, Kaiser Permanente has a unique way on how we offer care. As far as every member has different needs. So please know within Kaiser Permanente, you're able to schedule that a phone appointment or video appointment 24 hours a day. You can email your doctor with non-urgent questions. If you have access to our kp.org app, you have access to view your lab results and doctor's notes, refill most prescriptions, schedule and cancel appointments, pay your bills over the app as well. What's most importantly is you could always manage your family members' care. So if you have a child with you, it's easy to manage your family members' care. If they are minors, you could email their doctor as well, and they could work with you. So this is a great option to have. We invite everyone to register on kp.org so you have access to these great options available to you that are very convenient. Now, for support for your mind and body, please know that Kaiser Permanente wants to keep the whole you healthy. That's mind, body, and spirit. We have great options that are available to you. For emotional support, please know that you have access to licensed therapists. We also have available to you self-care apps that are the Calm app that's available to Kaiser members as well. And we also have Headspace, which is texting for emotional support. Please know that with these options, if you're a Kaiser member, we highly recommend visiting kp.org/self-care apps. With this option, you register, create user ID and password, and then download the app and just log in. And it's free being a Kaiser Permanente member. We also have wellness coaching over the phone, and this is a highly underutilized option. I know we always set goals towards the end of the year. Please know that we have wellness coaching available to all members all year long. Maybe a birthday's coming up and you want to set a goal, maybe to eat healthier, lose weight, or stop smoking. We also work with you. We connect with you over the phone, 20 minutes a week, based on and working with your schedule. So please know that we have these options that are available to you at no cost, just by being a Kaiser Permanente member. Also, what we have available are healthy classes, and please know that we have gym discounts. So if you're a Kaiser member, we also have gym discounts that are available to our members. So please take advantage of those options. Moving on to the next slide. If you are looking to expand your family, please know that we have a world-class maternity care that's available to you. For those new, again, Kaiser, I was a new Kaiser mommy that was expecting. So this was just a great experience that I had. You have a dedicated prenatal care team that's going to work with you. You could create a personalized birth plan, care and support every step of the way, and also support that doesn't stop at delivery. So we have other options after. We have classes and programs that are available to you as well. So please know that these is something that is available as a Kaiser Permanente member. And what I would like to do is just do a high-level overview of your benefits. Again, as mentioned earlier, I will be available if anyone has any detailed questions on benefits that I could help you with, or facilities as well. So as you can see, it's a traditional HMO benefit. You do have a maximum out-of-pocket, but please know that preventative care is covered at no charge. Your office visit, outpatient surgery, you have a $15 copayment. There is no copayment for lab and radiology services. You do have an emergency care copayment of $50, and your prescription copayment is a $5 copay for generic, $20 copay for brand name for a 30-day supply. We highly encourage our members, if they are taking any maintenance medication, to take advantage of our mail order prescription program. You do get more for your copayment, and it's convenient. You get your medications directly at home. Also, we do have the CalPERS Kaiser Permanente Medicare Senior Advantage plans available for you. Again, this is just a quick overview. I will have these available in our break room for specific questions. If you do want to learn more about your benefits or any wellness program that we have available, or you're maybe wanting to switch your physician, you could always scan the QR code, and we have that information there, or you could reach out to the 800 number that's listed on the slide. And just very quickly, service updates in California. We have, as you know, we're top-rated health plans in California for over 9 years in a row. Our quality of care, we have 17 years of recognition for the top-rated quality medical care available to you. And as far as across California, we have 441 medical facilities and more than 17,700 doctors available to our members. And we're producing recognized results for our members. So please know that at Kaiser Permanente, we do have our physicians that work only for Kaiser Permanente, that treat only our members. And again, it's your care team that's connected to you, and they have your information in real time. Updates in Northern California coming soon. We have the Modesto Sports Medicine Center that's available and scheduled to open August 2025. Our Fresno Orchard Plaza medical offices that are scheduled to open in October of 2025. Modesto medical facilities that are scheduled to open in January 2026. And now open, we have Santa Rosa Infusion Center, open March 2025. Salinas Medical Offices that are opened January 2025. Santa Rosa Ambulatory Treatment Center opened December 2024. And Santa Rosa Urgent Care opened March 2024. San Francisco Urgent Care, that's open January 2024. These are our convenient locations in Northern California that are available to our members. Updates in Southern California. This slide has all the information of the updates that we have here in Southern California, but I know I am running out of time. I'll be more than happy to go over this information in the breakout room. And I would like to thank everyone for your time and attention, and thank everyone that's a Kaiser Permanente member. Thank you for your membership.
All right. Thank you so much for that, Rachel. We're going to move now to Blue Shield of California. We have back with us again Alex Garcia. So, Alex, would you take the mic for us?
Thank you so much, Katrilia. I'm going to go ahead and share my screen.
Okay.
And once again, everyone, my name is Alex Garcia. I'm with Blue Shield of California. I'm going to be going over the HMO plans that are available to you. I'm going to start off with what will be different going into the 2026 year. We have two updates. We have an update and enhancement on our mobile app. You will now have the ability to make online appointments to many of our providers. So this is a great thing, and we'll be talking about some of the other enhancements as well that have been implemented. And then we will be transitioning from Magellan Mental Health Network to our Blue Shield of California Mental Health Network. What this does is this expands our list of mental health professionals to our members. So you will have more doctors available to you in the coming year. So just a quick overview of our two HMO plans that are available to you. We have the Trio HMO option and Access Plus, and you will. I'm sorry, someone was talking.
Yes.
Yeah, so here's a quick overview of our two plan options. We have Trio HMO and Access Plus HMO. These are two options that are available to you, and I'm going to go over the differences shortly. You will notice that there are nearly identical plan designs with an enhancement on the Trio HMO option. You will see that available to you is the chiropractic and acupuncture benefit on both benefits or both plans. Again, you will see an enhancement on the Trio option. You'll see that both have Teladoc for medical services. Teladoc has an extra benefit that expands mental health using the Teladoc app so that you can speak to a mental health professional over the phone. But both plan designs do have medical, and both, as you can see, have the mental health benefit at a $15 copay. So we can go over what are the differences. I think I lost a slide, but really quick, I'm just going to go over that. Trio HMO is a plan that is not available in all locations. It is available in select areas, making it affordable to you. So if you're looking at having an HMO with the affordability as a component to it, you may want to choose Trio HMO. Access Plus HMO is an expanded list of doctors across California. So those are generally the two differences between both plan designs. In terms of pharmacy benefit, we have the CVS retail pharmacies. You can also use Safeway, Bonds, and Costco. And you may also use the CVS pharmacies that are inside the Target stores. If you're looking for delivery to your home, we are using Amazon Pharmacy for our delivery vendor. So if you're taking medication for more than 90 days and would like to have your medication sent directly to your home, we are using the Amazon service. And for specialty medication, we will continue to be using CVS as our specialty drug provider. We do have, as I mentioned earlier, that there are some enhancements to our mobile application. I mentioned one where you can make appointments online, but also there is a pharmacy component upgrade to your application. This is real-time push notifications linked to provide you a view of lower cost alternatives. So when a doctor submits a prescription, you will be able to see that prescription immediately on your application, and you can review other options that are similar medications but will have a cost savings component to with you. So you can have that conversation there with your doctor and see which medication is right for you. And you would also be able to see the pharmacies that would provide you the greater cost savings as well. Now, you do have fixed copays on your plan design, but this is just another option for you to consider. The mobile application also has a member health record component. So this allows our members to view doctor visits, lab results, prescriptions, and so much more, all in the convenience of your mobile device. For those of you who would carry your phone, I think that's all of us, wherever we go. And you might save yourself some time from digging through your wallet. You can also view your Blue Shield ID card and add it to your mobile device wallet so you can always have a fresh copy. We have other convenient options for you to get your care as well. These are virtual options as well as other options that are included in your Blue Shield membership. You have the Nurse 24/7 service. This allows you to connect to a registered nurse and get reliable information 24 hours a day, 7 days a week. This is a free service, so you can also use the chat option to chat with a nurse, advice nurse also. Now, for those of you that might want to speak to a doctor, we do have a teledoc included in your plan as well. This is a zero copay benefit, also available 24/7, and you can speak to a doctor, whether being it on phone or video capability, and speak to a doctor regarding some areas of care like flu, allergies, sinus problems, things like that. And they do have the ability to prescribe medication for you. Urgent care facilities are also available to you, so that is another option for you to consider in situations where it is a non-emergency, but you'd like to see a physician immediately. Of course, your both plans, Access Plus and Trio option, covers you for emergency services worldwide, no matter where you are, and you can get your coverage when for those emergency situations. Mental health services, as mentioned in the summary, are included in both your plans. Here are some other options that you can get support. We have digital programs like Headspace, Headspace Care. These are digital applications that will help you with meditation, sleep, self-guided relaxation techniques, and other applications that are available to you, just mentioning two. And then you have the virtual options for those of you who will elect Trio HMO. You have the teledoc service where you can connect with a behavioral health provider and get your care. In addition to that, 24-hour nurse line also provides a service for mental health support, as well as support with our life referral program that connects you to licensed therapists and other professionals. And of course, there is always that in-person care option that you are aware of. So this is a self-referral service. So if you are interested in seeing a psychologist or other mental professional support and substance abuse, you can always look up our in-network providers within our website, and you can call, make an appointment, and show up. So again, this is a self-referral service. There's no need for you to speak to your doctor or medical doctor to get access. Maternity programs, we have some great programs that we have introduced over the past 2 years. We have virtual on-demand appointments with practitioners. We also have the doula program. We have care advocates that are there to answer your questions during your pregnancy. We have virtual maternity classes, and we have resources available for you when you decide to return to work. And you can find more information on our website on blueshield.ca.com/maternity. And so for those of you who are interested in Wellvolution, we do have that service as well. As you can see, I won't read all of these services, but if you'd like to get more information about what wellness programs we have available, you can see these options there on your screen. These are options that are there to help you with your well-being, physically, mentally. We have also quit smoking programs, weight management, diabetes prevention, and exercise, as well as lowering your blood pressure. And our website is available 24/7. So if you are interested in finding out more of what is available to you, I will be in the breakout room. I will show you how to find a doctor, where to go for additional resources, and I'll be able to take your questions in that breakout room as well. And really appreciate your time. I'm going to hand it back to Katrelia. Thank you so much, Katrelia, and all of you.
Thank you. Thank you so much, Alex. That was perfect. Uh, Someone put in the chat regarding, I thought we had PPO options, and um, I indicated that since January 2025, our PPO options have been handled, are being handled by Included Health. So we have two representatives here today. We have Ryan Martinez and Carletta Moncrief. I hope I said that correct, Carletta. That will be providing you with an overview of Included Health services. I personally have used them and I am happy with them. And so with that, I'm going to turn it over to Ryan and Carletta.
Perfect. Thank you so much. All right. Hello, everyone. My name is Ryan Martinez, and I'm a representative with Included Health. Thank you for having us today to join your session. We'll be walking you through a short presentation to give you an overview of the PERS Gold and PERS Platinum PPO plans as you prepare for open enrollment this year. We'll also let you know what's changing for 2026. As a reminder, open enrollment is coming up. It starts on September 15th, ends on October 10th. Included Health launched the PERS Gold and Platinum members last year and will continue to be the member-facing support for all of your plan needs. Blue Shield of California will continue to be the network and the administrator for the PERS plans. And when you call the number on the back of your ID card, if you're already a PPO member, you're directly speaking with Included Health for all of your healthcare needs. So what's changing? For CVS Caremark, they're going to be your new pharmacy benefit manager, replacing Optum Rx for 2026. For Gold Plan members, there will be new options for lowering your inpatient deductible up to $500, which I'll be going into more detail in just a few slides. For ABA therapy services, Magellan will no longer be the network. ABA services will be transitioning to the Blue Shield of California's network of providers. So at a high level of what these two plans look like, there are no changes to the co-payments, co-insurance, or deductible structure for the new year. Starting with the Gold Plan is available to members that work or reside within California. The network is narrower when compared to the Platinum Plan. This plan offers flat copays for office visits. This plan is suited with your budget in mind. For the Platinum Plan, this plan offers the broadest network of providers and is available to members residing nationwide and internationally. This plan also provides the highest level of coverage. I'll now go into highlights of both of these plans. Going back to the Gold Plan, I'll share some highlights here. So Gold Plan members have the flexibility to see providers in their network for the lowest cost. There are no referrals required to see specialists. Preventative care is covered at 100%. When you see your PCP for non-preventative reasons, you will pay an office visit copay, but as a Gold Plan member, you have a lower copay when you see your matched PCP. This is a $10 copay. The Gold Plan also offers incentives to lower your deductible by participating in certain programs and activities. And here's a little bit more detail on what those certain plans and activities look like. So for the Gold Plan, we have some more options in lowering your inpatient deductible for 2026. We'll see some updates here regarding mental health screenings, some additional additions for preventative screenings, as well as diabetes prevention. For the PERS Platinum Plan, some highlights here. As I mentioned before, the plan is the highest level of coverage and broadest network of providers. There are no requirements for referrals or to see a specialist. Preventative care is also covered at 100%. If you have visits for acupuncture and chiropractic services, you can go straight to those providers. Lab services are covered at 100% when you go to Quest or LabCorp. If you do travel out of state, you have coverage for routine, urgent, and emergency care. If you travel internationally, you also have coverage options under this plan. Now a little bit more about who Included Health is. Included Health offers members a single central resource for all healthcare needs, from administrative tasks to complex clinical support. Our team of member care advocates and clinicians helps you find high-quality providers, schedule appointments, and navigate the healthcare system. Services include expert medical opinions for making informed decisions on diagnoses or treatments, as well as access to our network of virtual providers for primary care, urgent care needs, and therapy and psychiatry. You can easily access all of these services 24/7 through the Included Health app or by calling us. With open enrollment approaching, here are some recommended next steps on what to do for 2026. So if you're already a PPO member, you can confirm your providers are in network by calling us or searching your Included Health account. You can also confirm your matched primary care provider in the app. Non-PPO members visit the Included Health CalPERS microsite for a public provider search tool that's coming soon. If you prefer to speak with someone, you can also give us a call and we can help you directly. So to wrap us up, thank you for your time, and we'll be in the breakout room. If you have any questions, feel free to give us a call or download the app to chat us there too. Thanks.
Good job. Okay. Was that it, Ryan?
That is
All
it
right.
from Included Health. Yep. Carletta and I will be in the breakout session if anyone needs.
Awesome. Thank you. All right. Now, for those of you who, like myself, take quite a bit of drugs, and we're talking prescription. All right. Let's keep it clean here. Just be aware that OptumRx come January 1, 2026 will no longer be our pharmacy benefit manager. And therefore, as we switch over to CVS Caremark or CVS Health, there may be changes in the formulary. So that's why I definitely want to hear from none other than David Chalk to see what he has to share as a 10-minute overview of what we should be anticipating come January 1. So David, take the mic, please.
Yes, I'm happy to, Petralia. Thank you for that. I'm going to start sharing my screen here. And as you mentioned, I know change could be uncomfortable, but rest assured, I see your face, Petralia. Yeah. But rest assured, I'm here today. I'll be here. CVS is here, and we will have a dedicated phone line open starting 9:15 to answer any questions that I cannot answer today. So please feel free. We'll talk about it more at the end of the conversation, but any unanswered questions, we will be here to support. So to start off with, essentially, what is CVS Caremark? We are essentially your health plan, but for prescriptions, meaning that when you go to get your prescription filled, you can get it filled at a CVS retail location, a CVS specialty location, CVS mail order, or I'm going to skip ahead a little bit more here. One of the 64,000 pharmacies that are in network. Within the state of California, you could see that there are 706 CVS pharmacy locations. CVS pharmacy, as was mentioned before, in Target stores, there's 271 of them. Quite a lot of Targets, to be honest. I did not expect that. And then CVS EMAS stores, there's 96 of them. And we have also minute clinics and health hubs. So going back to the start of the presentation, I want to talk to you a little bit about the enrollment timeline and what to expect, as this is completely brand new. So starting off, you either have or you will soon receive an announcement from CalPERS saying that CVS will be your new prescription benefit manager. Going forward from that, you will also be receiving a welcome kit that includes a summary of your benefits, your evidence of coverage, and you will also have a link to look at a formulary online and your pharmacy networks in line. So any of the 64,000 CVS pharmacies that are in network, I'm taking that back, I'm sorry, they're not all CVS pharmacies, but all the pharmacies in the CVS network, there will be a link where you could find where you can go to. We try to minimize disruption, so it should be a seamless transition for you. And if it's not, we are here for you. That welcome kit will be arriving sometime around December. I encourage you to pre-download the CVS Caremark app. We will be talking about that a little bit later. You'll be able to enroll after the 1/1/26 plan year starts. And the most important part I want to touch on is your ID cards. You'll be receiving them before 1/1/26. And since this is a change where you're typically filling your prescriptions now, you're going to want to make sure that you take this ID card there so your pharmacist can enter this bill correctly and make sure that it is a seamless transition for you. So it's not going to reject on your old ID card if the pharmacy bills that way. So definitely make sure you have that on hand the next time you do go to the pharmacy in case there is any issues. So there is potential for disruption. It's not often, but we talked about formulary changes before. If something were to fall off the formulary, the Medicare CVS formulary, depending on your age, you will receive a letter. Your prescriber will also receive a letter 60 days before the change takes place, and your prescriber will talk to you about any alternatives that are available. They will still be the same drug class, they will still be the same effective alternatives, but sometimes, unfortunately, they just fall off of the formulary with change. But rest assured, your doctor will get you back on the right plan if that were to happen. And, hopefully it doesn't, but if it does, there's other alternatives that are there. So your doctor will speak to you that, like I said, they will be notified as well. So that is that for the formulary changes. Again, going back to this one, I just want to highlight how many CVS pharmacies there are. I'm sure you've driven past multiple of them pretty much every single day. There's retail chains, independent pharmacies, and as highlighted here, there's over 1,000 retail locations in California. I will talk about this a little bit more later, CVS specialty pharmacies and CVS mail order. But again, any changes, we do have the dedicated line for CalPERS members that will open on 9/15. So I want to start with medications now. One that has personally benefited me because it did lower my drug cost. The potential to get 90-day supplies at your retail pharmacy. So for medications that you take continuously, such as diabetes, high blood pressure, asthma, and more, they will be available at a 90-day supply. It will be at retail, and you could also do it via mail. Again, this will be sent to you, but there is a link that says caremark.com/pharmacy locator, and you could look up any single in-network pharmacy on this link that will show you where you can get those 90-day supplies. CVS mail order that I touched on. It's a benefit because it could deliver straight to your home. A 90-day supply, and it could potentially offer cost savings. Safety, it is delivered in nondescript packaging, so it protects privacy. Nobody knows what you're getting, and it's delivered straight to your door. It saves you time from going to the retail pharmacies. If you're working, if you're not working, sometimes you just don't want to go to the pharmacy and wait in line. And so this could be a good benefit to get it delivered straight to your door. And here's another link right here, caremark.com/RX delivery, that you could look up to see what would be available to you. And this is another big one for anybody out there that's managing complex conditions, such as cancer and things like that. We have dedicated pharmacists in our CVS specialty stores that are pretty much like your doctor, that are, I'm going to highlight the bottom left here. They're specialists really in managing your medications that treat your condition. So we always are available to help you with any questions that you could. And you will receive a letter from CVS also saying if you're on these medications, if you want to get them from CVS specialty. And lastly, to wrap it up, here's the important notes here that I would recommend taking down. For active members, we do have our dedicated customer care reps, this 833 number. I would take this down. These phone lines open 9:15, as I mentioned. So any questions that I can't answer today, our team would be happy to help you. And for Medicare members, those of you moving into that direction, this number is also available to you on 9:15. So any questions, you can please call in. If you're not sure what you reside in, or if you're not sure who to contact, I would recommend, if you're moving into the Medicare plan, I should say, I would recommend starting with the active member number. And if it's something they can answer, they will transfer you over to our Medicare members. Here's the big one that's personally benefited me the most. Registering within the CVS Caremark system and the application. With the application, you're able to see all of your prescriptions, when they're going to be delivered, and anything else you could possibly imagine. You'll be able to register, beginning of the plan year on there, but it's never a bad thing to download it early. That way you have it, and it serves as a reminder. But I definitely recommend, registering for this on 1/1/26. Also to highlight, you do have a dedicated CalPERS website that also goes live on 9/15, which will be sent in all the mailings that you will receive. Any other questions, I will be available in the break room. And then, like I said, if I can't answer them, our team on 9:15 will be able to answer them on these phone numbers. So that is all I had to share. Thank you, Katralia. I will pass it back to you.
Thank you, David. That was perfect. The information I needed for myself and family members, actually, that are on the plan. Well, we have heard from our health plan, CalPERS health plan representatives, and I was going to have a 10-minute breakout session, but I saw a lot of questions being answered in preliminary questions being answered. I think we should move to more detailed questions in the breakout rooms. But before we do that, I want to